Okay, so this gets us to our next question, that is caspase independent programmed cell death is. देखो, in our previous subsection we saw necrosis and apoptosis. Now the examiner has asked you caspase independent programmed cell death, ABCD. Answer बचे. Whenever I ask this question in a face-to-face class, normally students tend to mark it as necrosis or apoptosis, but no. देखो, programmed है ना, programmed cell death, तो necrosis is out. Caspase independent. Apoptosis क्या है? Apoptosis is caspase dependent in nature. So caspase independent. Apoptosis is out. क्या बचा? You are left with necroptosis and pyroptosis. Pyro मतलब fever. Pyro मतलब fever. That is, it is apoptosis associated with fever. So the answer by default that is left in this case is necroptosis. So let us now have a detailed look at necroptosis. What do we mean by necroptosis? What does necroptosis mean? देखो, let us assume the extrinsic pathway of apoptosis is activated. Let us assume extrinsic pathway of apoptosis is activated. Extrinsic pathway of apoptosis, this in turn leads to, which is the initiator caspase of extrinsic pathway? Remember extrinsic pathway, two friends came from outside, 8 and 10. Which is the main initiator caspase? Caspase 8. This in turn leads to activation of caspase 8. This leads to activation of caspase 8, which goes to executioner caspases, which in turn goes to executioner caspases and apoptosis. This is the normal routine pathway of apoptosis. This is normal, you know this. But suppose there is failure of activation of caspase 8. There is failure of activation. Of caspase 8. Because of failure of activation of caspase 8, this in turn is associated with mitochondrial damage. Failure of activation हुआ ना, mitochondrial damage, reduced ATP, in turn leading to necrosis. So what started as apoptosis ends as necrosis. This is called as necroptosis. It started as apoptosis, ends as necrosis. So I can safely say necroptosis is programmed or non-programmed? Programmed, because it started as apoptosis na, so it is programmed caspase dependent cell death. It is programmed caspase independent cell death. Why caspase independent? Because there was failure of activation of caspases. Next point, biochemically it is apoptosis. It started as apoptosis, so biochemically it is apoptosis, but morphologically it is necrosis. It ends as necrosis. There was failure of activation of caspase, which in turn leads to mitochondrial damage and necrosis. तो इसमें inflammation भी होगा, it will be associated with inflammation. Morphologically it is necrosis. This is called as necroptosis. Next point. अच्छा, इसमें एक term और देखते हैं. Let us have a look at pyroptosis also. Let us have a look at pyroptosis also. Pyro means fever. So it is fever associated apoptosis. Apoptosis है ना. So programmed है कि non programmed है? Programmed है. So it is programmed cell death. First point, it is programmed. It is programmed cell death associated with fever. So it is characterized by release of fever inducing cytokine. It is characterized by release of fever inducing cytokine. That is, which is the most potent pyrogen? Which is the main cytokine that causes fever? We'll do this in our next chapter, inflammation. But which is the most potent pyrogen or which causes fever? Interleukin 1. It is characterized by fever-inducing cytokine interleukin 1. Next point, and is associated with formation of inflammasomes. देखो, all these are the words which are asked in MCQ. जैसे ही pyroptosis है, pyro, fever, interleukin 1, cytokine interleukin 1, associated with formation of inflammasome. Which are the main caspases associated? Caspases, it is associated with caspase 1 and 11. It is associated with caspases 1 and 11. These were your two miscellaneous terms, necroptosis and pyroptosis. Next point. So this gets us to our last two miscellaneous topics in cell injury, that is cellular pigments and calcifications. So let us start with our first miscellaneous topic, that is cellular pigments. This gets us to miscellaneous topics, pigments and calcifications. Starting with pigments, I can divide pigments associated with a cell into two types. देखो, या तो endogenous pigment हो सकती है, it can either be endogenous or exogenous pigment. Endogenous or exogenous. Which is the most common exogenous pigment? We live in a very polluted environment. Which pigment is present in pollution? Carbon. Who will eat up this carbon? In pollution, when we inhale carbon enters into our lungs, which is eaten up or which is taken up by macrophages. So we see the presence of carbon-laden macrophages. In the lungs. That is the most common exogenous pigment, carbon. Versus endogenous pigments. There are three main endogenous pigments. 3 endogenous pigment है. कौन सी? Which are lipofuscin, melanin, melanin and hemocitrin. There are 3 main endogenous pigments which are lipofuscin, melanin and hemocitrin. We'll do each one of these one by one. Let us start with our first endogenous pigment. पहली वाली से शुरू करते हैं. Let us start with our first endogenous pigment, that is lipofuscin. Let us start with lipofuscin. What is lipofuscin? Lipofuscin, this is wear and tear pigment of the body. Lipofuscin, this is wear and tear pigment. This is wear and tear pigment of the body. What do I mean by wear and tear pigment? That is, it is associated with cell aging. It is associated with aging. That is what I mean. It is wear and tear pigment. That is, it is associated with aging. So, aging क्यों होती है? Because of free radical injury. So, I can safely say it is the telltale sign. It is the telltale sign of free radical injury. It is the telltale sign of free radical injury. ये तीनों पॉइंट सेम ही है. Lipofuscin, it is the wear and tear pigment of the body. Wear and tear aging के साथ होगी, so it is associated with aging, and it is the telltale sign of free radical injury. Telltale sign मतलब चोर की दाढ़ी में तिनका. जैसे अगर कहीं पे lipofuscin deposition हो रहा है, that means वहाँ पे free radical injury हो रही है. So it is the telltale sign of free radical injury. Next point, microscopically, very, very important. What is the color of lipofuscin? Microscopically, it is golden brown in color. Microscopically, which it is golden brown. Microscopically, it is golden brown in color. Present in perinuclear location. Present around the nucleus. It is a golden brown perinuclear pigment. It is golden brown in color. Normally students make a mistake and they say it as brown. Brown नहीं है. When I talk of brown pigment, I mean hemocitrin. We'll just see that in 2 minutes. Lipofuscin, it is golden brown in color. Golden brown perinuclear pigment present around the nucleus. Next point, lipofuscin, which is the stain used. Stain used for lipofuscin. For lipofuscin, which we use the long Zn stain. For lipofuscin, we use the long Zn. Zn is Zeal-Nielsen staining. Stain used for lipofuscin, long Zn stain. Zeal-Nielsen staining is used for tuberculosis. Long Zn, matlab the staining time has been increased. So we use the long Zn, long Zeal-Nielsen stain, that is lipofuscin. Next endogenous pigment. I'll project this for another 10 seconds. इस स्लाइड को अच्छे से देखना. देखो pigments and calcifications. छोटे छोटे टॉपिक्स हैं but you get questions from the same. This was lipofuscin. Next endogenous pigment. Next endogenous pigment is melanin. Next endogenous pigment is melanin. Next is melanin. What is melanin? Melanin, is it a heme derived pigment या non heme pigment है? Heme derived है कि non heme है? Non heme. It is a non heme derived pigment. It is a non heme derived pigment. Heme derived कौन सी है? Heme derived is hemosiderin. Non heme pigment है melanin. Which are the normal sites? Which are the normal sites in the body where melanin is present? Normally, melanin, it is present in skin. All of us, we are dark skinned. Why? Because of the presence of melanin. Normal sites, skin, hair follicles, skin, hair follicles, iris of the eye. Skin, hair follicles, iris of the eye. देखो ये तीन तो बहुत obvious है. These three were very obvious. Skin, hair follicles, iris of the eye. Next, it is present in brain. कहाँ पे? It is seen in substantia nigra. It is present in substantia nigra and locus coeruleus. Present in substantia nigra and locus coeruleus in the brain. And lastly, it is also seen in stria vascularis of inner ear. Lastly, it is also present in stria vascularis of inner ear. These are the normal sites of melanin. पहली तीन obvious थी. Skin, hair follicles, iris of the eye. They were obvious. What you have to remember is brain. Brain में कहाँ? Substantia nigra and locus coeruleus of the brain, stria vascularis of inner ear. These are the normal sites of melanin. Next point. अच्छा, what is the tumor of melanin called as? Tumor of melanin secreting cells. It is called as melanoma. So which is the stain used for melanin? How do we know that it is this pigment? ठीक है, melanin, it is black in color. But how can we be sure कि melanin नहीं है? By using a special stain. So which is the stain for melanin? M for melanin, M for Mason-Fontana stain. So stain used for melanin, Mason-Fontana. देखो M से melanin, M से Mason-Fontana. Stain used, Mason-Fontana stain. And lastly, on IHC. IHC stands for immunohistochemistry. This is the first time in Path we are using this word, immunohistochemistry. इसके बाद आगे जहाँ पे भी we will use it in various tumors. We will see it in the chapter neoplasia, general path only. We will see कि कौन सी IHC, which marker, which immunohistochemistry is positive in which tumor. So which is the immunohistochemistry for melanoma? There are two main markers associated, that is HMB45 for melanomas, which there are two markers, HMB45 and S100. Which is more specific? Which is more specific for melanoma? HMB45 or S100? HMB45. This is more specific. This is more specific for melanoma. More specific का मतलब है कि S100, it can be seen in tumors other than melanoma also. S100 melanoma के अलावा it is seen in other tumors also. किसमें? It is seen in LCH, that is Langerhans cell histiocytosis. It is also seen in LCH, that is Langerhans cell histiocytosis. So which is more specific for melanoma? HMB45. This was your second endogenous pigment and very very important. Melanin, हमने देखा the normal sites where melanin is present. The stain used under immunohistochemistry, HMB45. And this gets us to our last endogenous pigment, that is hemosiderin. Which is this gets us to our last endogenous pigment, that is hemosiderin. The name tells you everything. This is a heme derived pigment. This is a heme derived pigment. This is heme derived. Next point. Which stain is used for hemosiderin? अच्छा, सबसे पहले तो मुझे ये बताओ, फर्स्ट टेल मी दिस, अब हीम डिराइव्ड है, कहाँ से आई? It is present at sites of local hemorrhage. It is present at sites of local hemorrhage and bruising. Present at sites of local hemorrhage and bruising. Suppose somebody has pinched you or somebody has hit you, तो वहाँ पे blood extravasated and went outside. So it is present at sites of local hemorrhage and bruising. Next point. Which is the stain used for hemosiderin? Stain used. Girls, you wear necklaces made of gold, diamond, platinum, silver, agreed, and pearls. Stain used, pearl stain. It is not the pearl necklace, so A nahi aata. Stain used, pearls, also called as Prussian blue stain. Stain used, pearls, also called as Prussian blue staining, These are the pigments. So there were three endogenous pigments: lipofuscin, melanin, and hemosiderin. Whereas the most common exogenous pigment was carbon. So this takes care of our pigments. And this gets us to our absolute last topic in the chapter cell injury, that is calcifications. This gets us to calcifications, a very very important topic and totally understanding based. If you just understand this once, that calcifications, they are of two types. Dystrophic calcification, we will write everything below this flowchart, but you just understand this once. दो types का है, dystrophic versus metastatic calcification. If you just know this, you will know everything about this. Starting with dystrophic calcification. D से dystrophic. So dystrophic calcification, it is seen in dead or damaged tissue. Dystrophic calcification, it is seen in dead or damaged tissue. Versus metastatic calcification, which is seen in normal tissues. Versus metastatic, which is seen in normal tissue. कौन से normal tissues में मिलता है? Where in the normal tissues? Most common site being lungs. Other sites of metastatic calcification are kidney. Kidney में कहाँ? Renal tubules. Other sites are kidney. In the kidney it is seen in renal tubules. Stomach. कहाँ पे stomach में? That is gastric mucosa. It is seen in gastric mucosa. So sites of metastatic calcification. It is seen in normal tissue. Most common site is lungs. Kidney में renal tubules. Stomach, gastric mucosa. Next, it is also seen in pulmonary veins. And systemic arteries. It is associated with or seen in pulmonary veins and systemic arteries. These are the sites of metastatic calcification. Next point, serum calcium. Calcium levels in the blood. Serum calcium. Dystrophic calcification, low, normal या high. Serum calcium in dystrophic calcification, which is normal. देखो, think of it yourself. Blood में, serum में calcium normal था, but it goes and gets deposited in dead or damaged tissue. Blood में the calcium was normal. Versus metastatic calcification, where serum calcium is high. Serum calcium was high. That is why it is going and getting deposited in normal tissues. That is metastatic calcification. नेक्स्ट पॉइंट देखो, अंडरस्टैंड दिस स्लाइड वंस, एक बार समझ लेंगे इट विल बी लाइफ लॉन्ग यू विल नॉट फॉरगेट इट. डिस्ट्रॉफिक, डी से डिस्ट्रॉफिक, डी फॉर डैमेज टिश्यू. सो डिस्ट्रॉफिक कैल्सिफिकेशन डैमेज टिश्यू में होता है. इन डिस्ट्रॉफिक कैल्सिफिकेशन सीरम कैल्शियम इज नॉर्मल. कैल्शियम नॉर्मल है बट इट इज गोइंग एंड गेटिंग डिपॉजिटेड इन नॉर्मल टिश्यू. वर्सेज मेटास्टेटिक कैल्सिफिकेशन वेयर सीरम कैल्शियम इज हाई. कैल्शियम हाई है, दैट इज वाई इट इज गोइंग एंड गेटिंग डिपॉजिटेड इन नॉर्मल टिश्यूज. नेक्स्ट पॉइंट, एग्जाम्पल्स. डिस्ट्रॉफिक कैल्सिफिकेशन से शुरू करते हैं. लेट अस स्टार्ट विद डिस्ट्रॉफिक कैल्सिफिकेशन. The first example of dystrophic calcification is it is associated with atherosclerosis. It is seen in atherosclerosis. RHD. It is also seen in RHD, that is rheumatic heart disease. RHD, rheumatic heart disease. Next, Acha, I want you to tell me this. What is calcification? Calcification in muscle layer, that is in tunica media of the vessel wall. Calcification in muscle layer, that is in tunica media of the vessel wall called as. Calcification in muscle layer of the vessel wall is called as Monckeberg medial sclerosis. Calcification in the muscle layer of the vessel wall, it is called as Monckeberg medial sclerosis. Monckeberg medial sclerosis, calcification in tunica media of the vessel wall. We'll just see that. I'll show you the image of that. And lastly, what is calcification? Dystrophic calcification seen in tumors. Body के किसी भी organ में एक tumor हुआ है, which is associated with calcium deposition. Calcification in tumors is called as psammoma bodies. These are the examples of dystrophic calcification. देखो, it is the calcification associated with diseases. Atherosclerosis, RHD, rheumatic heart disease, Monckeberg medial sclerosis and psammoma bodies. बहुत important and बहुत commonly asked question है, which are the tumors associated with calcifications? That means psammoma bodies are seen in which tumors? It is associated with PTC, papillary thyroid carcinoma. Psammoma bodies, they are seen in PTC, papillary thyroid carcinoma. Next, papillary renal cell carcinoma, papillary RCC, that is papillary renal cell carcinoma, papillary RCC. Next, ovarian tumor. Which ovarian tumor? Please put a star. Serous or mucinous? Which ovarian tumor? Serous ovarian tumors. Serous ovarian tumors. Next, meningioma. कौन सा CNS ट्यूमर? meningioma, prolactinoma, and mesothelioma. Meningioma, prolactinoma, and mesothelioma. These are the tumors. These are the 6 tumors associated with psammoma bodies. PTC, papillary thyroid carcinoma, papillary renal cell carcinoma, serous ovarian tumors. Please note, mucinous नहीं है बच्चे. Serous ovarian tumors, meningioma, mesothelioma and prolactinoma. These are your examples of dystrophic calcification. Versus metastatic calcification. Where serum calcium is high. Examples of the diseases. Which hormone is needed for increased serum calcium? Parathyroid hormone. Parathyroid hormone increases serum calcium. That is, it is associated with hyperparathyroidism. It is associated with hyperparathyroidism. Serum calcium is increasing. Why? अब hyperparathyroidism क्यों होगा? Either it can occur because of parathyroid adenoma or carcinoma. मतलब देखो, try to understand this. Hyperparathyroidism मतलब parathyroid hormone is increased. तो या तो there is a problem in parathyroid gland. There was a parathyroid adenoma or carcinoma जिसने parathyroid hormone को increase करा. Or it can occur because of lung cancer. Patient had lung cancer. This lung cancer secretes parathyroid hormone. Is lung the normal site of secretion of parathyroid? No. If lung cancer is secreting parathyroid hormone, what is it called as? It is called as paraneoplastic syndrome. It is called as paraneoplastic syndrome. You will be doing this when we study lungs. So hyperparathyroidism या तो parathyroid adenoma और carcinoma हो गया, या it is associated with paraneoplastic syndromes. So first example of metastatic calcification is hyperparathyroidism. Next example of metastatic calcification. In which blood cancer calcium is increased? Let me write it like this. In which blood cancer calcium is increased? Multiple myeloma. Multiple myeloma. What is multiple myeloma? It is a malignancy of plasma cells. So multiple myeloma, it shows increased number of plasma cells. Multiple myeloma, it shows increased number of plasma cells with any one graft features. What is multiple myeloma? It is a malignancy of plasma cells. Plasma cells increased, and we'll see that when we study hematology. Plasma cells increased number of plasma cells with any one graft features. CRAB stands for hypercalcemia. Calcium is increased, hypercalcemia. R, renal insufficiency, anemia, and bone lytic lesions. So multiple myeloma में क्या हो रहा है? It is a cancer of plasma cells. Plasma cells are increased in number. Increased number of plasma cells with any one graft features. CRAB means calcium is increased, hypercalcemia, renal insufficiency, anemia, and bone lytic lesions. Because calcium was increasing, hypercalcemia था ना बच्चे. So which calcification is seen in multiple myeloma? Metastatic calcification. Whenever calcium is increased, it is a case of metastatic calcification. Next example of metastatic calcification is, Asha, you tell me, which granulomatous lung disease shows increased calcium? जब भी हम lung disease की बात करते हैं, granulomatous lung disease associated with granulomas, two main diseases come to our mind, TB and sarcoidosis. किस में calcium increased होता है? Sarcoidosis. It is associated with increased calcium, hypercalcemia, because of secretion of vitamin D3, because of secretion of 125 dihydroxy vitamin D3. 125 dihydroxy is the active form of vitamin D3. Secretion of 125 dihydroxy vitamin D3 from the granulomas because of secretion of 125 dihydroxy vitamin D3 from the granulomas. Sarcoidosis. And the last example of metastatic calcification is extensive skeletal metastasis. Last example is extensive skeletal metastasis. Meaning, what does this mean? Suppose patient has any cancer, extensive skeletal metastasis. Patient has breast cancer, which metastasizes to the bone. Breast cancer bone में चला गया. Extensive skeletal metastasis हो गया. As a result of which, there will be osteolytic lesions leading to increased calcium. So extensive skeletal metastasis causes increased serum calcium leading to metastatic calcification. These were the types of calcifications. So I can divide calcification into two types. एक बार इसको दोबारा देखो. I can divide calcifications into two types. Dystrophic versus metastatic. Dystrophic calcification was seen in dead or damaged tissue versus metastatic normal. Normal tissue में क्यों deposit हो रहा था? Because serum calcium was high. So what are the causes of metastatic calcification? Hyperparathyroidism, parathyroid hormone, multiple myeloma, that is increased number of plasma cells with any one graft features, multiple myeloma, sarcoidosis, granulomatous lung disease, sarcoidosis, and extensive skeletal metastasis. Versus what are the examples of dystrophic calcification? It is seen in atherosclerosis, RST, rheumatic heart disease. RHD, calcification in muscle layer of the blood vessel, that is Monckeberg medial sclerosis, and calcifications associated with tumors, that is Semoma bodies. So this takes care of pigments, this takes care of pigments and calcifications, and this finishes the theory portion of our first and an easy chapter in pathology, that is cell injury. So before we wrap this up, have a look at this image and tell me the diagnosis. Be unbiased, be totally and totally unbiased. Which is the stain used here? This everything is pink and blue. This is HND, hematoxylin and eosin stain. क्या नजर आ रहा है? It is a luminal structure. ये lumen है. It is a luminal structure with presence of RBCs in the lumen. So it's a blood vessel. इस blood vessel में where is the problem? This is the problematic area. Something is getting deposited in the muscle layer in tunica media of the vessel wall. So diagnosis, calcifications, calcification in tunica media of the vessel wall, called as Monckeberg medial sclerosis, called as Monckeberg medial sclerosis, which is a type of dystrophic calcification, Acha, lastly, tell me the stains used for calcium also. This gets us to our last point, that is, which are the stains that we use for calcium. Stains used. कोई भी calcium, whether it is dystrophic or metastatic, does not matter. Which is the stain used for calcium? The most commonly used stain for calcium is the von Cosa stain. Most commonly used stain for calcium is the von Cosa stain, versus the most specific stain for calcium, that is alizarin redis. So stains used for calcium, most common being the von Cosa stain versus most specific, that is alizarin redis. Done, bache. This finishes your first topic in pathology, that is cell injury.